very different experiences during the COVID pandemic. To understand these experiences, we need to see where the countries were before the pandemic. And to take two examples, the United Kingdom and the United States. In the years pre-pandemic, life expectancy in both big countries had stopped improving at anything like its previous rate. In fact, in the US, life expectancy fell for 3 years, 2016 to 2018. And in the UK, life expectancy, the rate of increase of life expectancy slowed dramatically. And health inequalities increased. In other words, if you look at people by where they live and look at where they live by level of deprivation, there's a social gradient. The more deprived, the shorter the life expectancy. And that gradient got steeper. And there were increased regional differences. And further, life expectancy for the poorest people was getting worse pre-pandemic. It was predictable that the pandemic would expose the underlying inequalities in society and amplify them. And that's what happened. We saw in the UK a social gradient in mortality from COVID-19 that was very similar to the social gradient in all-cause mortality, but slightly steeper for COVID-19 because people in the most deprived areas were employed in frontline occupations and living in overcrowded households. It's very important to learn lessons from this experience. Otherwise, we'll repeat the problems. My own view is that, and I published this in a report we did in Britain called Build Back Fairer, the COVID-19 Marmot Review, is that the increased social and economic inequalities, the disinvestment in public services that went along with austerity and reduced public funding, the fact that that was applied, those cuts were applied in a most unequal way, the poorer the area, the bigger the cuts. And the fact that we weren't very healthy coming into a pandemic meant that we did poorly during the pandemic. In fact, out of 20 rich countries, the US had the biggest decline in life expectancy in the 2 years, 2020 and 21. And the other countries that did poorly were Scotland, Northern Ireland, Germany, and England and Wales. It's very important to learn these lessons. And it comes back to the kind of choices you make about social and economic policy. After the global financial crisis, countries had a choice. Were they going to stimulate their economies in a Keynesian way, or were they going to cut austerity? In the UK, we cut, and we cut in a regressive fashion, and arguably that led to the increase in inequalities. Simply claiming that austerity did only good and couldn't possibly have done any bad is flying in the face of the scientific evidence. In the US, it's more complicated because there was a stimulus after the global financial crisis. But in the eyes of many economic commentators, that stimulus was of insufficient magnitude. And there was an increase in inequalities. So those social and economic policies that pertained pre-pandemic were likely to have affected the outcome during the pandemic. And it's precisely to look at these questions that UNAIDS has invited me to co-chair a new global council on inequality, AIDS, and pandemics. The other co-chairs are Joe Stiglitz, Nobel Prize-winning economist in New York, Columbia University, and Monica Gangos, human rights lawyer and First Lady of Namibia. And we will be looking at these questions of inequality, AIDS, and pandemics to make recommendations about how to do things better in the future.